Welcome to Quick Facts. Today we will be looking at vital signs. This is particularly important if you are a medical student, a nursing student, or an emergency technician student, or perhaps you are a qualified professional in the medical industry and are just looking for a refresher. Now, the disclaimer to this is that this is not meant to substitute a professional's opinion. This is particularly important for patients that might come across this. If you are looking to interpret your own vital signs, you would need to be seen by a medical professional so that your vital signs are interpreted in context. By definition, vital signs are an objective measurement of essential physiologic function in a living organism. In the context of this lesson, we are looking at vital signs in human beings. And the reason they are vital is because they are one of the first things you would look at when you do a patient's clinical evaluation. So if you have a patient's case note, when you go to the bedside, you already have an idea, just looking at their vital signs, what you might find, what you might be worried about, and what you might need to make sure is not going on at that particular point in time. The four vital signs are temperature, pulse rate, blood pressure, and respiratory rate. Now, these are the traditional vital signs. But I also want to add here that something that is very vital would be the oxygen saturation, which is usually checked using a pulse oximeter. And I think a lot of people would have seen this being used a lot when we were in the heat of the COVID-19 pandemic. On this slide, we're looking at temperature. The body's temperature is regulated by the hypothalamus and usually has a set point of 37 degrees Celsius with a range of 36.5 to 37.5 degrees Celsius. Temperatures below 35 degrees Celsius are regarded as hypothermia or hypothermic. And hypothermia can also be categorized into whether it's mild, moderate, or severe. In terms of fever, we can also think of it in terms of low-grade fever or high-grade fever, with fever or pyrexia being temperatures more than 37.5 degrees Celsius. A normal pulse rate in an adult is 60 to 100 beats per minute. And in children, the heart rate is dependent on their age. However, from age 12, we can start to apply the adult pulse rate ranges to children. When a heart rate is less than 60 beats per minute, it is called bradycardia. This means that the pulse rate is abnormally low. When a pulse rate is more than 100 beats per minute, it is called a tachycardia, which means that it is abnormally high or abnormally fast. In addition to knowing how fast the pulse rate is, we also want to know if it's regular or if it's irregular. But to get a firm diagnosis of what is causing the heart rate to be irregular, if you feel it being irregular when you palpate it, an ECG will be able to help you determine what exactly is causing the irregular heart rhythm. And ideally, when you check for the pulse rate, you want to palpate both the radial and femoral pulses together to check for radiofemoral delay, which could be a sign of coarctation of the aorta. Now, when somebody is tachycardic, it might mean that their body is compensating for something going on in the background, such as maybe when a patient is in shock or if a patient has sepsis. Blood pressure. This is the pressure within the blood vessels. in particular within the arteries. And the blood pressure has two components to it. There is a systolic component and a diastolic component. Now, these two components are really the phases of the heart's contraction and relaxation. The systolic phase is the heart's contraction phase, and the diastolic phase is the heart's relaxation phase. So the systolic blood pressure, this is the pressure within the blood vessels, or within the arteries rather, when the heart contracts. And then the diastolic blood pressure, this is the pressure that the blood exerts against the arteries when the heart is in its relaxation phase. The systolic blood pressure, the range of normal is from 100 to 120, whereas with the diastolic blood pressure, the range of normal is 60 to 80. But these numbers need to be interpreted in context of the patient, which is why we usually advise in clinical practice that patients must not Google their symptoms, but rather they must consult a qualified practitioner to help them interpret their blood tests or blood results or vital signs in context. Now, the blood pressure is important because it can tell you if you are dealing with a patient that is suffering from hypertension, or if you're dealing with a patient that is suffering from hemodynamic shock or from hypovolemic shock. The normal respiratory rate of an adult is 12 to 20 breaths per minute. And you actually want to count the respiratory rate for an entire minute. In children, their respiratory rate is also dependent on their age. In an adult, when the respiratory rate is less than 12 breaths per minute, we call this bradypnea. And this may be a sign of respiratory depression, which may be a side effect of medication or may signal an underlying disease. If the respiratory rate is more than 20, we call this tachypnea, and it may be a sign of respiratory distress, such as when a patient is having an acute asthma exacerbation, a COPD exacerbation, or other acute problems causing difficulty breathing. In conclusion, the four vital signs that we traditionally expect on a patient's case notes are the temperature, the blood pressure, the pulse rate, and the respiratory rate. But when we practice good medicine, we might want more information, such as having the oxygen saturation, as well as the blood glucose. These are not really vital signs per se, but they are important as well when you're making your clinical evaluation, especially in an emergency setting.